Let's see an NCLEX tips and points video on pulseless electrical activity and ECG review. What is pulseless electrical activity? There are occasions when the electrical conduction system is functional, but the heart muscle is not responding with a contraction. This is called pulseless electrical activity or PEA. If not treated quickly, the electrical conduction system will eventually stop working because of the lack of oxygen to the heart's pacemaker cells. Causes of this pulseless electrical activity include hypoxia, that is lack of oxygen, hypovolemia, that is low blood or fluid volume in the circulatory system, hyper or hypokalemia, that is high or low blood potassium levels, acidosis, that is excessive acids in the body, hypoglycemia, low blood glucose level, hypothermia, that is low body temperature, medication toxicities, that is overdose of medicines, pericardial tamponade, that is excessive blood or fluid around the heart, pneumothorax or collapsed lungs, myocardial infarction, and pulmonary embolism, that is blood clot in the lung, to name just a few. So these are the causes of pulseless electrical activity. The treatment for pulseless electrical activity is chest compressions, epinephrine, and treating the possible causes. With this in mind, it should not be assumed that a patient will have a pulse because you see a rhythm on a cardiac heart or heart monitor. Make sure that you palpate for a pulse to confirm that the heart is pumping and circulating blood. So these are some important points which are related to pulseless electrical activity. What are the steps in ECG interpretation? This is another thing which you need to know. When evaluating a cardiac rhythm, ask the following questions to yourself to help identify the rhythm seen on the ECG. Is the rate fast, slow, or normal? That is the first question you need to ask. Then, is the rhythm regular? Are complexes an equal distance from one to the next? Are the distance from the P wave to the next P wave equal throughout the strip? This is referred to as the PP interval. Are the distances from QRS wave to QRS wave equal throughout the strip? This is referred as the RR interval. Are there P waves present? Are there QRS complex present? Are there T waves present? Are the intervals within the normal limit? Example, the PR interval or the QRS interval. Is there a P wave before every QRS? Is there a QRS after every P wave? These are some of the questions which you need to ask when you are interpreting an ECG, a normal ECG. Most ECG or monitor paper time markers represents 3 seconds, which is 15 large boxes. If you see an ECG sheet, if you count, you can see number of large boxes and small boxes. And 3 seconds is equal to 15 large boxes, and when we are seeing, we have to mostly check for 6 seconds, that is equal to 30 large boxes. In order to use this method of 30 large boxes, count the number of QRS complex that fall within a 6-second period of time or 30 large box, and we need to multiply it by 10. So if you see 6 QRS complex in this 30 large boxes, you need to multiply it by 10 and which will get a 60 beats per minute. The heart rate is 60. The number of QRS complex within the 30 large boxes into 10. Another method to calculate heart rate is to count the number of small boxes between two R waves and then divide that number into 1500. As an example, if there are 19 small boxes between two R waves, calculation is 1500 divided by 19. So you will get a heart rate of 17, and this is a second method. Any method you can use. And another method which is to count the number of large boxes between two R waves and divide that number into 300. For 5 large boxes, the calculation is 300 divided by 5. So heart rate of 60. So in any of these three ways you can see or calculate the heart rate using an ECG paper. Hope you understood this video. Thank you so much. Please do keep watching.